if I traded it all.
So welcome back. So excited about having my next guest on. I have one of them has been with me a lot of times now, but also she brought her. I guess it's an associate with her. I
partner.
have a partner.
Yeah.
Right now I have with me Dr. Linda Ma and her partner Dr. Kent Sperling, and they are right now. They're with this practice which is Smile Innovations. Right now it's located in Tempe. I know you have another office that's going to be opening. We're going to talk a little bit about that. First of all, I want to welcome you to the show and tell us a little bit about yourself, because Dr. Kent, you have not been on the air with me before, and a little bit about what you do and maybe what you specialize in over at Smile Innovations.
Sure. This is my first time here on the radio, Carol. It's good to be here. I want to say thanks to you and for the listeners for listening today.
Okay, go ahead.
I'm a native of Arizona. I've been practicing for 13 years now, and we specialize in pretty much anything from bonded fillings to crowns, same-day crowns, dental implants. We work in dental lasers as well, and mostly minimally invasive dentistry. And that's one of the things we want to talk about today is minimally invasive dentistry.
Well, thank you for that, because I hate the idea of cutting my mouth or shots in my mouth and all of that. Nobody likes to go. Dr. Ma, you've been on a few times now before. Why do you think that the people don't like to go to the dentist?
Because of finances and pain.
Right. I agree with that more than anything. And I never asked you this before, and I'm going to ask you now. Do you help people in terms of, that part of it? Obviously, pain, I know you got to have something for us, Doc, please. But, in terms of the other side of it, the finance side, do you also have that too at the office?
Yes, we do. We offer finance programs and care credit, and we take all credit cards, and we're here to help the patients.
Okay, so we're going to talk a little bit about invasive. Is that how I say it?
Minimally invasive.
Minimally?
Just the opposite.
I would say minimally, I'll say it right, invasive surgery for your mouth. And also, we want to get it out right now. You are going to offer for everybody. You always do this when you come on. You get entered into WIN. It's an in-home teeth whitening, which is way different. Do you want to describe what that is? What makes it so different between some of the ones that they could buy over the counter?
The in-home teeth whitening, it's much more powerful than you can get over the counter, so it does work faster. Results, you may end up getting the same results long term, but if you're looking for that quick fix, that pow, especially for that event you're going to, that wedding or the graduation or the whatever you're going to, the home trays are way to go.
And we all want that POW. We all want our teeth white. That is something that everyone wants. This is a $500 value free to you. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. You do free consultations over there?
Absolutely.
Okay, so they also do free consultations, and we're going to leave the lines open also throughout the rest of the show to get entered into WIN an in-home teeth whitening. It's a $500 value free to you. Our number here is 602-277-5369, and toll free it's 1-866-536-1100. I want to talk to you a little bit about minimally invasive surgery.
Yeah, minimally invasive surgery. It's pretty much what everybody wants, and that's the way medicine and dentistry is going these days. You look at traditional dentistry, you're cutting off a lot of the tooth that doesn't need to be cut off. Same with the gum surgery, same with extractions. With traditional dentistry, if in the old days, if you had a symptomatic tooth, the dentist would take it out.
Okay, so what can you do? Can anything be done minimally?
Everything can be done minimally, from a cavity to periodontal therapy to extractions, and even tooth replacement with implants can be done with minimally invasive techniques.
Okay, so let's talk a little bit about the ones that you want to talk about today, okay? Mm-hmm. So when you do it like that, let's say you need a root canal. Can that be done that way?
It can.
Really?
Because when we're doing a root canal, we have to go in and clean out the diseased nerve inside of a tooth. And when that's done, you can go in very conservatively to take out the tooth structure only that needs to be taken out. On top of that, when the tooth is restored, any tooth that has a root canal has to have a crown on top of it. Well, we can make crowns minimally invasive as well.
Wow. So it makes it faster and much easier on the patient. Faster
and easier, and in the long term, better for the tooth itself. You can compare, if you say you have frostbite on a toe, does the doctor take off the whole leg? No. Ideally, you'd want just the toe taken off. Well, in traditional dentistry, the whole leg was taken off, if you can make that analogy.
Right. I understand what you're saying. It used to be that way, but now it's a lot easier, and it's a lot easier on the patient, and they also make it easier for you also financially because they have in-home financing that you can do with them as well. You're located in Tempe,
Yes.
right? And your website is Smile Innovations.
No, innovation.
Just one. Okay, so innovation.com. So it's just one innovation. So smileinnovation.com. Their phone number, they do free consultation. It's 480-418-2469. We also have our lines open here for everyone to get entered in to win. The holidays, even though you may not think of it, they are coming up upon us. Everyone likes to have those beautiful white smiles. So our number here is 602-277-5369, and you're getting entered in to win an in-home teeth whitening, and that's a $500 value free to you. I have your questions now in front of me too, and you had mentioned in there that you wanted to talk a little bit about Light Touch Dental. Is that what this is all about?
That's what we're leading up to, yes. We're very excited to open Light Touch Dental. It is a new practice, a unique practice in Northeast Mesa.
So you're going to be opening up that practice, is that's what it's going to call Light Touch Dental? I love that.
Light Touch Dental.
So when is it opening?
We're looking at mid-September as our target date.
Okay, and it's going to be in Mesa?
That's right.
Okay, and so we're going to be having you back on again, hopefully, for that, so we can talk a little bit about where that is and when that opens up. You're probably going to do something special for everybody, right?
Definitely.
Okay, so what can dental lasers then do for people?
Dental lasers can be used for many things. They can be used for something as simple as preparing a tooth for a filling, taking out a cavity. They can be used for treating periodontal disease minimally invasively as well. They can be used for treating muscle disorders like TMJ. People that grind their teeth, they come in with muscle problems. I've treated a lot of people like that.
Get a little bit closer to the mic. Go ahead.
Sure.
And so, okay, I want to talk to you also, Doctor, because
Okay.
Dr. Ma may make you talk a little bit for us, okay? For the laser, when you've been on the show before, we've talked a little bit about your practice. You said that you can basically almost do anything to have somebody have a beautiful smile and healthier teeth.
Yeah, we can contour the gums. We can do tongue tie releases. We can treat ulcers. So if you have herpetic lesions, if you catch it early enough, you can treat these horrible symptoms before it actually explodes. So before your date, you kind of know when it comes. If you come right before it blows up, we can treat it with a laser to stop that burst of infection.
Wow. Now, what did you say? Tongue-tied? I want to get that again because you got to tell everybody what that is. We've mentioned that one time when you were on. And tell everybody what that is. It's amazing. Go ahead, listen.
Okay, so when your tongue is tied, it affects you in how you speak. Because you know how some people stutter or they can't speak, or for babies, if they're newborn babies, they can't attach to the mom. So sometimes the mom thinks that there's a problem with her, but it's actually just an issue of releasing the tongue tie. And once you release that tongue tie, that baby can attach. You have normal emotional connection with your kid again. So a lot of times, you know, the baby's cranky because they can't eat.
Right.
So without your tongue, you can't drink or eat properly.
Wow, it's amazing that you can do all of these different things. And you even said that it can help people with their speech the last time that you were on to do something like that. Does it hurt? Because it's minimally invasive, right? So how does that work?
Well, you're giving the least amount of pain. Sometimes we do require numbing to do it, but oftentimes the numbing could just be a topical numbing gel that's put on the tissue, so there's no shot involved.
Oh, I like that.
And before, they usually use a scalpel to cut it. So a lot of times when you release the tongue, you use a scalpel and you have stitches. So with the laser, there's no stitches because you're actually cauterizing the tissues right there.
Well, I'll tell you what, our lines are open here, and I know that everyone wants to have a beautiful smile and a healthy smile, and a lot of us don't go because we know that, number one, we think it hurts, and it doesn't anymore. They've made it really easy and pain-free practically, as well as it's costly, but they've also helped you with that. So they do free consultations in their office. You can call them direct. Their phone number is 480-418-2469. Their website is smileinnovation.com. They're located in Tempe. And what I know about them that they've said many times before that you've been on is basically you have a whole roof, one roof of that where you can almost get anything done to give you a healthy, beautiful smile. for you and your whole family, correct?
Yes.
Absolutely. Now, we've got our lines open. We're going to go to a break, and when we come back, we're going to talk further about the new office that you're opening in Mesa. And also, we've got everyone entered in to win. It's an in-home teeth whitening. It's a $500 value free to you. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. Keep on calling in. It's smileinnovation.com.
If I traded it all.
So welcome back. And we're talking with Dr. Linda Ma. And what's your name, doctor? I
Kent Sperling.
Okay. And I wanted to get this straight. Right now, you're both at Smile Innovation in Tempe.
Yes.
And you're opening up a new practice.
That's right.
And that practice that is opening is called what?
It's called Light Touch Dental.
And I love that because that means that you're not going to hurt us, Doc.
That's exactly right.
Exactly right. It's opening up in Mesa sometime in September, you said.
That's right.
So you must be really excited about that.
We're very excited. It's a very exciting time in dentistry with all the technology that's evolving, and we're able to give patients what they need and what they want.
Well, we're going to go a little bit more narrow and deep on that because I
Sure.
really like to do that. And I like educating the public, especially when it comes to things that they may not realize that they can do. That's what this show is really all for them to kind of get educated on that. So let's talk a little bit about the lasers and what the benefits of using a laser surgery or laser dental, whatever you would call it, techniques as opposed to what they've been doing.
Sure. From the start, we've been talking about things being minimally invasive. Part of being minimally invasive is you're saving as much natural, healthy tissue as you can, and that can apply in any type of surgery, from orthopedics to dentistry. When I first got into lasers, the reason I found that is because I started practicing with a dental microscope. Under the dental microscope with the traditional drill, I could see the microfractures that were occurring in the enamel as I was preparing teeth for cavities. And I thought there's got to be a better way. And so I researched and I found the dental laser, and that was the perfect solution to that problem.
Yes, and also what's nice about it is that, like you said, it is so minimally invasive. What kind of downtime is there really with when someone comes in for that and uses that technique?
Well, the great thing about that is that oftentimes we don't have to do any numbing shot.
I
because
love that. That's the worst.
Everybody loves that, especially parents.
Right.
Because the parents grew up either having no shot and just having to sit through the drill, or not being numb enough, or having to leave with a numb lip. Well, a parent that can take their child to the dentist and have a cavity done with a laser, their child doesn't have to have the shot, they're comfortable during the procedure, and they leave without the numb lip.
Right. It's awful. I remember when I was a kid, I bit my dentist because he came after, he had it behind his back, and when he brought it out, it was a silver giant size thing with a needle that was so long, I thought I was going to die, and I did not want that in my mouth.
Yeah, that creates nightmares for life.
It was, and that's they're definitely why a lot of people do not go in and get their teeth cleaned or get anything that's going on wrong with them because they don't want to deal with the pain. They also don't want to deal with the downtime. That's big time too. Let's talk a little bit about what you can do for implants now. Will you be able to do things like all on fours or anything like that as well?
Definitely.
Okay, so let's talk about that and what the difference would be using the laser for implants as well.
Okay. So anytime we do an implant, it is a type of surgery because we're putting a dental implant down inside the jawbone. The difference with this, when we're using a laser, it is minimally invasive, and as Dr. Ma alluded to earlier, the ramifications of that are different. The fact that we are cauterizing the blood vessels, we're cauterizing the nerves as well, so that you're not getting as much swelling, if any. I've treated patients where I've done an immediate implant, and there was no bleeding that day, there was no pain that day. I always prescribe medication afterward for anti-inflammatories, but oftentimes it's not even needed.
Wow. I mean, it's such a difference what has happened with dentistry, and people should stop. They really need to get out there and just take care of their teeth, right?
That's it, yeah. I
mean, seriously, there should be no reason why, but I guess the only other reason would be financial, right?
Well, a lot of times, too, it's they feel embarrassed when they come to the dentist to let themselves go. And the embarrassment will probably stop them from coming too. So
are they embarrassed because of what their teeth look like, or they're embarrassed because they're frightened?
Because they don't want to listen to the dentist. Because we're going to ask them to make a commitment to take care of themselves. And if you make a commitment to take care of yourself, it will look like every 6 months getting a cleaning and making sure that it's kind of like getting an oil change for your car. So we take care of our cars better than we take care of our health.
Sure.
So most people, they don't have the time. Which is...
Well, it's an excuse. One excuse after the other.
Yes.
right?
Yes.
It's really what it's all about. And you right now are located in Tempe. You do free consultations. You'll be doing them in Mesa as well, which you're excited about opening up your practice, which will be sometime in September.
That's right.
Excited about that for you. And you can check them out, because what I love about them too is that you can basically go to them for anything. I mean, anything. So their website is smileinnovation.com. Their phone number direct, it's 480-418-2469. They do free consultations, and we're going to let you call throughout the rest of the show. Everyone's getting entered in to win an in-home teeth whitening, and that's a $500 value free to you or anyone you know. Our number here is 602-277-5369, and toll free it's 1-866-536-1100. What else should we talk about with laser?
Well, we alluded to why patients don't want to come in. Finances is one thing. Dr. Ahmad alluded to embarrassment. People don't want to be shamed by their dentist either. And a lot of people do experience that when they've not been in for a long time. They just don't want to face being shamed, be embarrassed about not being in. And the other thing is fear. Those people who've gone to dentists as children and had horrible experiences don't want to go back. And that's about 50% of the population goes through that, and it takes extreme measures in terms of pain to get them back into dentistry. One thing we offer, besides just caring for our patients and understanding where they're coming from, is offering dental sedation as well.
Okay, well, that's fantastic, because that's probably the best thing that anyone could do is go to sleep and wake up and it's all done, right?
That's it.
Right. But now, and is that safe? A lot of people have some issues about that, going to a dentist and having the dentist put the needle in their arm. Or how does it work? Is it that way, or is it done by pill? Are you really all the way out, or what?
Needle is one method.
Okay.
If you want to get completely put to sleep, then you're going to an anesthesiologist. But if you're in a general dental practice, you can do something as minimally invasive as oral sedation. And that's just something as simple as swallowing a pill the night before that you're relaxed. You come to the office, you take another pill, and pills are administered until you're comfortable. And we're monitoring vital signs the entire time, the heart rate, the respiration, so we know that your vital signs are intact. You're healthy. You are safe.
Right.
And we don't proceed if you're not.
Can you have children do that too? Do children sometimes get
Yes.
sleep dentistry as well?
Yes.
Okay, so even children. What can you do? What do you see most in children? You know, because there's a lot of kids that have bad teeth too. They don't have to be just older, right? And you obviously deal with children as well. So what do you see most with them?
I think because of the laser, it changes the feeling. So instead of numbing the kid, we're patient. We actually have a Netflix, so they watch cartoons, and we tell them a story. So I would tell them, okay, you know Transformers. So today you're going to be Bumblebee. You know how Bumblebee got hurt? So you're going to be Bumblebee today. And then when you use a laser, you're like a machine. So you just hear click, click, click. So you hear like a woodpecker. So that's the sound that you hear. And it shouldn't be painful at all.
Right. So that's
Yeah.
really neat, because you kind of work with the kids. Sounds like you make it fun. I'd be fine with that too if you did it to me, Doc. You know. So let's also talk a little bit more about some other these things that you can do. I want to talk a little bit about deep cleaning. Okay, because you mentioned cleaning and everybody should do it, but there is a lot of people out there that haven't gone to the dentist in years, because they put it off, or because they didn't want to, or they couldn't afford it, or whatever, and they need those deep cleaning. Can you talk a little bit about what that is, and do you have to have that done, or can you come in and start lightly, or does it have to be done? You just have to go through the deep clean. How does that work?
Well, periodontal disease is what you're talking about. And periodontal disease and dental decay are the two top bacterial infections of any in the world. They predominate. And as you alluded to, people don't come in. And when they don't come in, they neglect and they develop periodontal disease. The only way you can treat that is with the deep cleaning, by getting the causative agent out of there, which is the bacteria. Traditionally, with periodontal disease, you either had to go through deep cleaning or to go to the periodontist, the gum specialist, for the gum surgery, which involves pulling the gums back and scraping the bone. Does not sound like fun. With a dental laser, we can be more minimally invasive and treat that as well, because we can take out any diseased tissue and the bacteria at the same time.
Would they have to be put to sleep? Because I'm sure that when you're pulling back a gum and scraping off something off a bone, you got to go to sleep for that.
Most people do choose to go to sleep for that type of treatment. However,
even though with a laser?
with a laser, you typically don't need to. But like I said, people come in all shapes and sizes in terms of their dental fear. So we can offer that to people, even with the minimally invasive techniques, doing the sedation dentistry.
But it sounds to me also that minimally invasively, if you were to use that and you chose not to go to sleep because you could handle possibly whatever that pain would be, and it sounds like very little, that it would also keep that cost down as well for them. Is that correct?
That's right.
So, and again, I want you to mention in the office that you do have the in-house financial and what you do for those people
Yeah.
too, for that. Go ahead.
We can set up payment arrangements so that it can help, because basically it's just a financial priority, right? So most people would rather go on vacation or buy a new car or do other things because their health or their smile or their teeth is not as important. So to me, I don't think deep cleanings are really that expensive. I think cell phone bills are more expensive. I think cable bills are more expensive. So there's other things that are way more expensive that people choose to spend their money on. And in taking care of your teeth, you'll be healthy for life if you actually choose that.
Now, for Light Touch Dental, when you're going to open up this practice, why are people going to be flocking to you?
Because we are giving them what they want. They want minimally invasive dentistry. They want to be relaxed. They want to be comfortable. They want to be cared for.
Well, they're going to be opening sometime in September in Mesa. They're real excited about that. The Smile Innovations is in Tempe. You can check them out on their website. It's smileinnovation.com. And keep on calling. Everyone's getting entered in to win a in-home teeth whitening. It's a $500 value free to you. Our number here is 602-277-5369.